Now, we have lots more exciting information about medical awareness as it is Blood Cancer Awareness Month in the month of September. And here to talk about biomarker testing and how you can identify specific blood cancers and cancers of the bone marrow is Dr. Stein, as well as a patient, Shirley, joining us this morning. Thank you so much for joining us this morning, guys.
Thanks so much for having me.
So, Dr. Stein, you are here to talk about specific blood cancers. Tell us a bit more about AML and the importance of biomarker testing.
Sure. So AML, which is acute myeloid leukemia, is a difficult to treat cancer of the blood and bone marrow. It's one of the most common types of leukemia in adults. And this year in the United States, it's estimated there'll be 21,000 patients diagnosed with acute myeloid leukemia. It's a disease of older adults. Typically, the median age is 68 years old, and it occurs when a mutation takes place in the DNA of a type of white blood cell that causes uncontrolled cell growth.
So, Dr. Stein, tell us about targeted treatments and the effectiveness and importance of them.
Yeah, so targeted treatments are therapies that are very, very different from what you think about when you think about cancer therapy, which is chemotherapy. Chemotherapy just sort of non-specifically kills rapidly dividing cells, whether those are healthy cells or whether those are cancer cells. And targeted therapies target the specific mutation that is causing the cancer. So think about it as a key for a specific lock. The cancer cells have that specific lock. We have the key that we can give patients to target that cancer and get that cancer cell to die.
Well, it's definitely important to know more about that. Now, Shirley, you are living with AML. Tell us about the specifics of your diagnosis.
Well, 10 years ago, I was diagnosed with MDS, myelodysplastic syndrome, and it progressed to AML, acute myeloid leukemia. I was a retired university professor at the time, and I took it on as a major research project that was very, very personal to me. And I suddenly realized I was going to have to be my own advocate, that no one was going to do the job for me. And I kept my blood draws going about every week or so, and I saw them slowly sinking. And at my lowest point, I was told by an oncologist, Shirley, you have 4 to 6 months to live. I consulted with some renowned specialists and said, what can I do? And they said, you need a biomarker test because you may have a mutation. So that was my next step.
Well, you look wonderful, and we appreciate hearing how you were your own advocate to find out your diagnosis. Now, Dr. Stein, tell us about mutational testing and how that can help diagnose AML.
Yeah, by doing this mutational testing, which has a couple of other names that a patient might hear, either molecular profiling or biomarker testing, it really lets us understand how cancer operates in the body and to develop new treatments for that cancer. So testing for mutations, like mutations in a gene called IDH1, which can occur in up to 10% of patients with AML, is really important. And that can be done either through testing the blood or through getting a sample of tissue from the bone marrow. And this biomarker testing has really paved the way for these targeted therapies. It's really important for patients to have a discussion with their oncologist whether biomarker testing is being done.
And Shirley, so what role did biomarker testing play in your diagnosis of your AML?
Well, it was just a routine appointment. My oncologist handed me the paper and said, Shirley, there's something new that has just occurred. You have a mutation, IDH1. And I said, what is that? And what does it mean? He says, it means that your disease is progressing. I didn't know it at the time, but that was a major turning point in my 10-year journey because it allowed my oncology team to devise a treatment plan that would target my disease that was just specifically for me. And I always say I was in the right place at the right time with the right mutation.
Dr. Stein, one last question for you. What questions should patients ask when going through a diagnosis for AML or other types of blood and bone marrow cancers?
Yeah, like Shirley said, it's really important for a patient to advocate for themselves, and they need to ask their oncologist, number one, are you going to test for mutations? Are you going to be doing biomarker testing? When are you going to be doing it? How long is it going to take for me to receive those results? And most importantly, how are my treatment options going to be broadened by the results of that testing? And you can learn a little bit more about this by going to this website, servier.us/biomarker testing, S like Sam, ERVIER.us/biomarker testing.
Well, Dr. Stein and Shirley, thank you so much for coming on to the show and talking about the importance of being an advocate for yourself, as well as getting routine blood testing and routine checkups to keep on top of your health. Now, stay tuned. We have our favorite recruiter guy coming onto the show shortly, so don't go anywhere. We'll be right back after this.